Hi, and welcome to the Clinical Engineering Certification webinar on the application exam process. My name is Jen Nichols, and I am the chair of the Book of Knowledge Committee.
And hi, I'm Katherine Navarro. I'm the Vice President of ACCE, which is American College of Clinical Engineering. And we're here today to provide an overview of the clinical engineering certification process to include requirements and what to expect for both application and examination processes. And just a note here, this webinar is prepared and offered by individuals, Jen and myself, who are not involved in the preparation of the CCE exam. Okay, so here's our agenda for what we'll be covering regarding the Clinical Engineering Certification Program. We'll start by going over the governance of the certification program. Then we'll talk about the why, different reasons you should obtain certification. Then we'll cover the certification process. We'll start with eligibility requirements and the application process, and then go over the written examination process as well as the oral exam process. Then we'll also cover the certification renewal process and then other certification statuses like retired and emeritus status. And finally, we'll conclude with a list of resources for the CCE certification process and how to reach out with any questions. So to start off, we first want to share the governance of the program, since we feel it's good to understand the entities that are involved and their responsibilities in the certification process. So first, the Certification Clinical Engineering Program is sponsored by the American College of Clinical Engineering, or ACCE, but the Healthcare Technology Certification Commission, or HTCC, actually oversees the certification program. And then reporting to HTCC, there are actually two boards of examiners, the US Board of Examiners and the Canadian Board of Examiners, which are the entities that actually administer the exam. Okay, so the purpose of the boards of examiners is to facilitate the continuous improvement of healthcare delivery in the US and Canada. And they do this by establishing a credible certification program, which is the CCE, that attests the professional competencies of clinical engineers related to the clinical engineering body of knowledge established by ACCE and to relevant US and Canadian regulations, codes, and standards, respectively. And they act as a repository of information concerning the certification process. So there are two certifications that you can receive, the CCE US, which is for clinical engineers from the US and then other international countries, and as well as the CCE CA, which is for clinical engineers from Canada. Okay, so you may be asking yourself, why should I get certified? And it's a valid question, and hopefully the next two slides will help you understand both the reasons to get certified and the benefits to getting certified. So this slide will show you more of the textbook definition. This comes from the handbook and gives you the purpose of certification in clinical engineering. And that is to promote healthcare delivery improvement through certification and continuing assessment of competency of professionals who support and advance patient care by applying engineering and management skills to healthcare technology. So the certification process includes one, establishing and measuring the level of knowledge required for certification as a clinical engineer. It also includes providing a standard of knowledge for certification, which can assist employers, the public, and other health professionals in the assessment of a clinical engineer. It also includes formally recognizing the individuals who meet the eligibility requirements and pass the clinical engineering certification exam process. And then lastly, it includes requiring continuing personal and professional growth in the clinical engineering practice in order to maintain certification. So, in other words, putting it into a less textbook definition here, obtaining certification in clinical engineering, first off, brings the clinical engineering profession in line with other regulated US and Canadian healthcare professions. Next, it provides recognition of initial and ongoing professional competency in the role of clinical engineers. Additionally, certification can aid in career advancement opportunities, both at home and abroad. And you may just have a personal desire to be certified, even if it's not mandatory for your position. Certification can also just set a good example for others within our professional field. And then finally, certification can help promote better visibility of our profession amongst healthcare leadership and peer healthcare professions. Okay, so now that we've hopefully convinced you to seek certification in clinical engineering with all the benefits that we listed on the last two slides, we're going to go through a high-level overview of the certification process. So the certification process starts with the application. This determines eligibility to sit for the certification exams by reviewing your education, experience in clinical engineering, and 3 professional references. So important to note, the CCE application deadline this year is July 21st, 2023. So you still have plenty of time to complete and submit it. There's also a one-time fee of $475 to apply and sit for the exam. And once you submit your application, it gets reviewed by the Board of Examiners. And then those applicants that meet the requirements are approved for the clinical engineering certification exam, which consists of both a written and an oral exam component. And you'll be notified of your application status at least 1 month before the written exam testing period. So the next step is, of course, the written exam. That is comprised of 150 multiple choice questions, and it has to be completed within 4 hours. So the written exam testing window this year is from November 4th through the 18th, 2023. And there are some fees associated with rescheduling or retesting that are listed here. So if you need to reschedule your exam within the testing window, there's a $50 fee. And if you don't pass the written exam and need to retake the test, that's a $175 retesting fee. There's not a fee otherwise. That's all included in that initial fee for the application. And after you take the written exam, you'll be notified in approximately 8 weeks of your exam results, and you must pass the written exam to move on to the oral exam. And the oral exam is the 3rd component here. It is for US and other international candidates. The oral exam will consist of 3 scenarios with questions, and for Canadian candidates, they will have 4 scenarios. During the exam, you'll have 30 or 40 minutes for US and Canada, respectively, to prepare and take notes on the scenarios presented to you. And then you'll have 20 minutes per scenario to deliver responses to the orally asked questions. You will not have the questions in writing. It will only be spoken to you. The testing window for the oral exam is in May of 2024 for the Canadian candidates, and that happens at the CMBEC, or the Canadian Medical and Biological Engineering Conference. And for the US and other international candidates, that happens in June of 2024 at the AME Exchange. If you don't pass the oral exam, there is a $150 retesting fee. But again, just to take it the first time, that's all included in that initial fee. And then after the oral exams are complete, the US and Canadian boards of examiners will review the examination results and then provide a recommendation to HTCC's board for certification approval of those passing candidates. And then you'll be notified of your results from the oral exam approximately 8 weeks after taking it. Okay, so that was a quick outline of the certification process. And now we're going to delve deeper into each of the 3 steps. So again, step 1 is the application. And the major part of this application process is just determining eligibility. So in order to be eligible to take the clinical engineering certification exams, you must meet certain education and experience requirements, and those are listed here on the slide. So starting off with US and other international applicants, you must meet one of the following education experience combinations. There's 5 different options. So the first is to be a licensed professional engineer in the US and have 3 or more years of clinical engineering practice or experience. Next, you could just have a Bachelor of Science or Engineering and a Master of Science or Engineering in an engineering discipline from an ABET or EAC accredited program and have 3 or more years of clinical engineering practice. Next, you could just have a Bachelor of Science or Engineering in an engineering discipline from an ABET or EAC accredited program and have 4 or more years of clinical engineering practice. Or another option is to have any bachelor degree as well as a Master of Science or Engineering degree in an engineering discipline without the accreditation requirement and 4 or more years of clinical engineering practice. And then lastly, you could have a BSET degree in engineering technology from a TAC or ABET accredited program and 5 or more years of clinical engineering practice. So for Canadian applicants, it's actually a little bit simpler, or a lot simpler if you look at it. You have to be a licensed professional engineer in the province in which you practice and have 3 or more years of clinical engineering practice. So the reason Canadians only have this one option is because in Canada, the word engineer is protected in every Canadian province. And to use the designation engineer, you must be a licensed professional engineer by law. Thus, by extension, using the term certified clinical engineer is protected also. and a professional engineering license is a prerequisite to apply for the CCE in Canada. There is no academic requirement for Canadian applicants, as well, because the provincial licensing body actually evaluates all applicants, either those from Canada or other countries, to assess their academic requirements during the professional engineering licensure process. So essentially, academics for Canadian applicants have already been evaluated to become a professional engineer in Canada, so we don't need to reevaluate that. And another note, just on the 3 or more years of clinical engineering practice needed for Canadian applicants, although a professional engineering license in Canada requires a minimum of 48 months of approved engineering experience, applications for the CCE will be assessed on clinical engineering practice. And so the CCE requirement for clinical engineering practice may be a part of that 48 months of experience for your license if it meets the definition of clinical engineering practice. And that's actually a good segue. We're going to go into that next. So this slide provides some clarifications on what we covered on the previous slide on education experience requirements, like what is clinical engineering practice. So in each of the options that we went over, it called for clinical engineering practice. So we provided that definition here. And so that clinical engineering practice is engineering practice consistent with ACCE's definition of a clinical engineer, which is a professional who supports and advances patient care by applying engineering and managerial skills to healthcare technology. So as long as your experience can fit into this definition of a clinical engineer, which again was supporting and advancing patient care by applying engineering managerial skills to healthcare technology, then your experience should count. But there are a couple exceptions to this, and those, please take note of those on the slide here. The first exception is that experience of technician level activities like routine assembly or testing and maintenance of medical equipment will not count. So you cannot count any experience in which you're doing technician level activities. Secondly, experience as part of an academic requirement like an internship that's required in order to obtain a specific degree will not count either. So that time you spent in the internship, even if you're doing clinical engineering practice, will not count for the application. And if you're an international applicant, we have a clarification here too, to just be aware that equivalent professional engineering licensure or equivalent degrees may be accepted from other countries than US. However, if you want to go this route, the applicant is responsible for obtaining an equivalency evaluation from an approved third-party evaluation agency. They have to be a member of NACES, and the website for that is listed here. And as well, the applicant is responsible for paying any associated costs for that equivalency evaluation, but that is an option for you. And then finally, the last clarification here is that if you're unsure if your degree program is accredited and you wish to be considered under one of those options that requires degree accreditation, you can visit the ABET website listed on this slide to look up your degree program. Okay, so after confirming your eligibility based on the education or licensure status and your experience, then you do need to gather all the required documents in order to submit your application. So the first document that's required is the completed application form, and this needs to be done in legible writing or printed. The application form can be found on the certification page of ACCE's website, or we've put it in our resources at the end of the presentation as well. So along with your application, you do need to provide a good quality photocopy of a government issued photo ID, like a driver's license or a passport. And then you also need to provide a resume or a CV showing your academic and career progression. And it does need to detail specific information that's requested in the application form. Things like the college and employer names, locations, dates, employment titles, etc. You'll find all of that in that form. The next document you'll need to provide is 3 confidential professional references. So these references need to be able to attest to your or the applicant's clinical engineering experience and abilities. For example, this could be like a nurse, hospital administrator, physician, other engineers, department managers, etc. But it is recommended to have a variety in the references that you choose. So try to choose people from different roles or different backgrounds that can attest to your abilities. And then also each of your references have to complete what's called the confidential reference statement for certification in clinical engineering form. And this can be found within the CCE application form, again, on the certification webpage. So please make sure you give your references sufficient time to fill out this form and complete this for you. And then, in addition to just completing it, they actually have to return the completed and signed form to HTCC directly by the email listed. And it's very important that you choose reliable references to make sure they send this form in to HTCC on your behalf by the deadline. And lastly, you need to provide an official academic transcript. This does have to be sent from the institution to HTC directly. And typically you have to request this through your institution and possibly pay a fee, which you would be responsible for. You can't send this to the transcript in yourself. That would not make it official. So make sure to request this through your institution with enough time to meet the deadline. And then just a note here, we kind of covered it before, but Canadian applicants don't need a copy of their official academic transcript, again, since their academics are already assessed as part of their professional engineering license. And then in addition to the documents, you will need to pay the $475 application fee by the application deadline as well. This can be paid by check, made payable to ACCE, or via credit card payment through PayPal using the link here, the CCE application fee link. If your application is not accepted, so let's say you didn't meet the eligibility requirements, the amount is refundable except for the $150 processing fee. So in summary, for the application step of the clinical engineering certification process, please make sure you have your application form, the 3 professional references forms, and the official academic transcript, as well as the application fee, all submitted by the application deadline of July 21st, 2023. Now I'll pass it over to Jen to go over the next steps of the process.
Thanks, Catherine. So the second step of the process is the written exam. You will receive notification from HTCC that the board has accepted your application for eligibility. However, if you want to take the written exam within 2 examination cycles after the application, your eligibility will continue. The test will be administered by the Professional Testing Corporation, or PTC, and that logo will show up on the emails that you receive. Notice you will receive an email from the scheduling authorization from PTC. We suggest you add that to your address book so it does not get sent to spam. We also suggest using an email address that will be on the current application, a current one, make sure it's current and correct, and suggest using a personal email address that you will follow you throughout your career. Please make sure you follow the instructions in the email to schedule the written exam appointment during the testing period, and the appointments are first come, first served. Prometric will send a confirmation email with the date, time, and location of the exam. And the exams can be rescheduled, as previously mentioned, within the testing period through Medica up to 5 days prior to the exam. If it's 30 days or more in advance, there is a $0 fee. If you are under 30 days, so between 29 days and 5 days, the $50 fee will apply. The exam format and content includes 150 multiple choice questions that must be completed in 4 hours. The questions are set and reviewed by the Board of Examiners, comprised of CCE. The knowledge base on the questions are from the ACCE Body of Knowledge Survey, which the last one was completed in 2021. And here on the screen, you can see each of the areas that will be included in the percentage of the questions that will be comprised from each area. There also may be some information on questions about basic underlying knowledge, such as anatomy, physiology, management, and engineering sciences. Please note that there may also be questions on standards and government regulations. The Canadian candidates, the US standard and government regulation questions will not count for your exam. They are not marked on the exam, but they will not count towards your total score. And US and other international candidates, the US standards and government regulation questions will count towards your exam score. So some tips when you take the written exam: please arrive early to the test center and check in. When you schedule the exam, take into account any traffic patterns and plan to be early, as in 30 minutes prior to your exam. Upon arrival, you must present a current driver's license, passport, or US ID, including a military ID, at the test center. Please note that anything expired, temporary, or paper licenses will not be accepted. Also to note, the name on your photo ID must match exactly to the first last name on your scheduling authorization. So pay attention when you complete scheduling so it matches your ID that you plan to present. You will be asked to check all of your items at the desk, and you will not bring anything with you, including pencils, calculators, papers, notes, smart watches, or phones. You will be provided a locker to put all of your items in. It's easier to leave them in the car. You can do that as well. Things to be aware of during the exam. There will be others in the testing room taking the exam. There will be no breaks during the exam. You can, however, step out to use the restroom. You may not bring papers, books, or reference material allowed for the exam, and there is no questions to be asked regarding the content of the exam. You will likely be sitting in a computer bank room for the 4 hours taking this test. As Catherine covered, the step 3 is the oral exam. From the completion of the written exam, it will take 8 weeks approximately for notification on your passing. You will only be able to schedule the oral exam with notification that you have passed the written exam. So again, approximately 8 weeks. The candidate, you will be contacted by HTCC to schedule that. And as we outlined, those oral exams do take place in conjunction with professional meetings at AME and CMBEC. The oral exam will be offered for 2 cycles within taking the written exam. If you need to, the retesting fee is $150. We do want to point out that candidates that are sitting for this exam are responsible for any necessary travel and associated costs. When it comes to taking the oral exam, suggestions include arriving 15 minutes before the scheduled time of the exam. I even suggest a dry run the day before to understand how long it takes you to get from your location to the exam, so there are no hiccups. Also know that you will be asked to present a valid photo ID, again, as you did for the written. It can be a current driver's license, passport, or military ID. And again, your name has to match as submitted. There are no electronic devices permitted to be used in the oral exam, and this includes smartwatches. So make a conscious note to take off your watch prior to arriving. As with the written exam, there are no papers, books, or reference material that can be brought in, out, or accessed during the exam. Candidates will, however, be given paper to take notes on as part of the exam. While you're in the exam, no questions concerning the content of the oral exam may be asked during the exam. And please note to listen carefully, and you can ask for questions to be repeated or instructions if needed. As with the written exam, you are not permitted to leave the room during this time frame, and you are asked to ensure confidentiality of the exam and the questions that are asked throughout this time frame. You can, however, bring water with you for any time you may need that access to that. The objectives of the oral exam are to assess the candidate's oral presentation of clinical engineering ideas in an organized and professional manner, as well as solving problems. So 2 things that are being assessed is your practical clinical engineering knowledge, as well as your oral communication skills. For the clinical engineering knowledge, they want to confirm the ability to utilize basic knowledge to solve a problem, that comprehensive, complex ideas can be delivered orally, and your ability to react to situations in an appropriate time frame. With the oral communication skills, they're looking to ensure that you can express your ideas in an organized manner, and that your ideas are articulated in a clear, direct, understandable, and professional manner. Your responses on the oral exam will be assessed with 75% of the weight going towards the information in your response, and 25% will be based on the verbal presentation of your response in an organized and professional manner. The exam format for the US and others in the international settings will include 3 scenarios describing a typical theme or issue faced by clinical engineering in a healthcare setting. If you are sitting for the Canadian exam, please note you'll have an additional 4th scenario related to the Canadian codes and standards. All scenarios will be presented in writing at the beginning of the exam. US and other candidates will have 30 minutes to review the scenarios. We suggest breaking that out to 10 minutes per scenario to allocate your thoughts on the papers. The Canadian exam, because they have 4 scenarios, will be given 40 minutes to collect their thoughts. Again, 10 minutes per scenario. The examiners, which typically are 2, will ask a series of 5 to 7 questions for each scenario for the candidate to respond to. This 5 to 7 questions will take place over a 20-minute period. Examiners can only repeat the question if needed. They cannot expand or clarify the questions. Please answer the question fully, but manage your time so you do not know how many number of questions are coming. So be succinct in your response. Any time remaining after all the questions are answered will be forfeited. They will not be added to another scenario. And examiners can take up to 5 minutes for making notes. Also, when you're answering questions, if there happens to be a similar answer between scenario 1 and scenario 2, do not assume that the information you shared in scenario 1 transfers to scenario 2. Be diligent about sharing those information for the scenarios that may have the multiple information that needs to be applicable to the answer. This slide here shows some differences between each of the different types of US versus Canada or international applicants. So if you want to look through this graph, you'll see the differences. The main difference, again, that we've highlighted throughout this process is in Canada, you'll just need your license as a professional engineer to continue, plus the 3 years of clinical engineering practice. US applicants or other international applicants, there are additional educational requirements, letters of reference, as well as your transcript. The application requirements, as you see, are fairly consistent with the exception of Canada not needing a transcript, as they have provided that in order to get their PE. The written format, everybody is consistent. There's 150 multiple choice questions across a 4-hour time period. The written exam, everything for the US and other international candidates is equivalent, and there will be questions on the US standards and government regulations. Again, as we previously mentioned, the Canadian applicants do not have to take the answers from the US standard government regulations. The oral format, US applicants and other internationals, again, 3 scenarios. You have 10 minutes per scenario to prepare and then 20 minutes per scenario to answer. And in Canada applicants, they will have a 4th scenario related to the Canadian codes. And you can see the time frame for US and other international applicants. It's 1 hour and 45 minutes total. And the Canadian applicants is 2 hours and 20 minutes because of the additional scenario that is presented. Once you successfully completed all 3 steps, you will have your certification issued. And from that point, you will renew every 3 years. With that information, you'll need to manage to complete a minimum of 15 points over a 3-year period and at least 2 points in 3 different categories. The categories are listed here on the screen, and they include employment, continuing education, professional activities, and miscellaneous activities. Again, the key note here is you have to have 2 points in at least 3 of the 4 categories. You will submit your renewal form electronically to HCCE at certification@acccenet.org. And Canadian candidates must also include a copy of their current professional engineer's registration. It is important to note that each candidate is responsible for keeping track of their certification expiration date and your renewal timeframe. Failure to renew prior to the certification expiration date will result in a loss of the active certification. We also wanted to mention that in the CCE, we have certification status changes for retired and emeritus status. The difference between a retired and emeritus, if you are retired, this certification is for those that have retired from active employment and wish to remain certified. The emeritus status is those individuals that are recognized for their lifetime contribution to the field of engineering. And this graph here compares differentiation. One, the retired, you're still active in the field and you'll keep your certification. The other, you earn your lifetime achievement, which includes at least 30 combined years of actively working in the field and actively certified in clinical engineering, or at least 15 years of documented committed continuous activity. Certification status will show not active on the registration, and there are fees associated if you want to keep a retired status versus an emeritus status. The application deadline for keeping your retired status is June 30th, and it does continue to require proof of continuous practice and additional renewal fees. We wanted to share some resources with you as you complete your ACCE certification. There are links on this page that are available for review. The ACCE certification page is listed here. We also suggest the CCE Handbook, and that is updated annually. You'll see the application form and the link for payment. For those that are in the process of renewal, there is a renewal handbook. There is also the renewal application form that can be clicked on for completion. And for those that are interested in retired or emeritus status, the information is in the handbook and application to change your status. This concludes our presentation for today. We did want to let you know that if you have any questions, you can email the address on the screen here at certification@acccenet.org. And we appreciate your time.